Assalamualaikum warahmatullahi wabarakatuh. My name is Nur Syafiqah binti Sobri, partner with Nurul Izzati binti Tajul Arif. We are from UNGS 2080 section 19 and now would like to present the most common and popular medical issue today entitled assisted reproduction method. Assisted reproduction methods are processes involving human reproduction that are widely used nowadays for infertile couples to find solutions in getting children. This treatment works for people who experience infertility for reasons including age, ovulation problems, blocked fallopian tube, genetic disease risk, lost pregnancy due to chromosomal abnormalities, or infertility for unexplained reasons. These techniques fall under alternative solutions for the unfortunate infertile couples to get a chance of having a baby. The methods regarding assisted reproduction involve the use of technologies and processes where gametes are manipulated outside the body. This infertility treatment handles both the woman's egg and man's sperm. We are here to discuss the top 3 commonest methods that are used by couples today that are in vitro fertilization or IVF, artificial insemination and surrogacy. Generally, infertility can be defined as not being able to become pregnant after having regular intercourse without birth control. Infertility can happen to both male and female, so these are factors that cause infertility, but the very main problem usually happens because of ovulation problem and blocked fallopian tubes. These are the statistics at which it proved that assisted reproduction method have been widely used nowadays, as the number of people into these methods keep increasing from year to year. Firstly, in vitro fertilization. Before that, you guys can pause this video and have a look at a video that we already attached together in the Padlet to understand more about IVF. This slide is just a short brief and introduction about IVF. Next, the procedure for IVF process to take place can be categorized into 5 steps that are pre-cycle preparation, ovarian stimulation, egg retrieval, embryo development, and embryo transfer. Firstly, the couple needs to undergo a pre-cycle diagnostic test, which includes several types of testings, such as a pelvic exam, blood test for male and female partners, transvaginal ultrasound, and hysteroscopy for the women. After performing the test, the couple will undergo a consultation with the doctor regarding the results and plan for the next treatment protocol. The doctor also will prescribe medicine for the female partner, especially in order to decrease the chances of forming cysts that could interfere with the start of the cycle and to synchronize the egg follicles. After that, the second step that needs to undergo is ovarian stimulation. The goal of IVF cycle is to generate as many mature eggs as possible to increase the success rate. Normally, the ovulation cycle produces 1 mature egg per month. In this phase, injectable medications are used to stimulate the ovaries and produce many more eggs for approximately 8 to 14 days. These medications used are derived from the natural hormones for the ovulation process that are FSH and LH. The end of this phase is when the HCG, that is a hormone, was shot into the eggs in the ovary. This HCG causes a trigger shot, which causes the follicles to develop. The purpose is to optimize the maturation of the eggs right before the ovulation takes place. So it can be said that the timing of this injection is very important for a successful IVF process. Moving on to the third process, which is the egg retrieval. Approximately after 36 hours of the final trigger shot, it can be told that the egg was already harvested in the ovaries. The ultrasound probe will be injected through vagina to seek for the follicle. The doctor will insert a long thin needle to and through the wall of vagina, guided to the ovary where the egg takes place. The suction device will be connected to the needle to collect several eggs from inside the follicles. This egg retrieval process usually takes 20 to 30 minutes time. After the eggs are collected, the next step to do is the embryo development, in which the fertilization will occur in the lab. In this phase, there are 2 ways for fertilization to occur that are through conventional fertilization or intracytoplasmic sperm injection or ICSI. The conventional fertilization happens by going through insemination. Several sperms are met and exposed with the healthiest egg to undergo fertilization naturally in the glass. However, for the ICSI, this new technique involves the direct injection of a sperm into the egg to fertilize. This ICSI is usually handled by very professional and experienced embryologists. Okay, then the fertilized egg or embryo will be monitored for 3 to 5 days. Lastly, for IVF, embryos may be transferred into the woman's body after being monitored for a few days. The embryologist will use a speculum and inject into the vagina to see the cervix. Then a syringe loaded with embryos attached to a long thin tube, or we call as catheter, will be inserted into vagina, cervix, and lastly uterus. The embryos will be injected and left in the body before removing the catheter and speculum. It was the final steps of IVF procedures, and the female partner needed to lie in bed for 15 minutes after the injection happened. There are also certain cases where couples prefer the embryos to be kept and frozen in the laboratory and decide to transfer them maybe in the later cycle or in the future. Among the factors that can influence the results of IVF are the age of the female partner, type of treatment the couple undergo, and the genetic abnormalities in either partner. The main problem here is involving the age factor, which we can say that the more the age of the patient, less chance of success, especially for the female partner. Women have limited reproductive lifespan generally when their age exceeds 35, and this will affect the IVF treatment due to lack of response to the drug, little chances of embryos implanting, and higher rate of miscarriage. The IVF treatment process may take longer duration like weeks, months, or years, depending upon the patient. It requires proper precaution and rules to make sure the treatment becomes successful. As stated before, the female partner needs to take a few medications in the early phase of treatment. Male partner is also recommended to eat right, exercise, and avoid bad habits such as drinking and smoking during IVF process. Besides, the patient may experience any number of side effects as appeared on the screen, and even maybe experience them all. One risk that many people overlook is the possibility of a multiple pregnancy with twins, triplets, or more. Okay, for artificial insemination. Artificial insemination, also known as intrauterine insemination, which is the treatment is quite similar to the previous IVF. The only difference of the procedure is part when the sperm is injected directly into uterus to allow it getting closer to the egg. The eggs do not need to be taken out from the female partner body and also do not require fertilization in a laboratory dish. Before the patient undergoes this treatment, the female partner will be given medications like ovulation induction in order to stimulate the development of multiple follicles or eggs. Then, the duration is timed and carefully monitored to make sure it coincides with the ovulation, which is the phase of releasing the mature eggs. The artificial insemination treatment needs to be performed during ovulation processes. Next, a process called sperm processing or sperm washing, which the semen sample of the male partner will be washed in order to separate other components of semen and concentrate in a small volume. This washing process usually takes time about 30 to 90 minutes. After that, a speculum will be placed to the female body to secure the provider to visualize the cervix. A small volume concentrated sperm will then be drawn up into a sterile, flexible catheter and gently inserted into the uterus. The sperm is placed at the top of uterus that is close to the opening. Later, the catheter will be removed and the female patients need to lie down for a few minutes before the treatment is fully done. Okay, for success rates of artificial insemination is quite similar to IVF treatment. Since artificial insemination is less expensive option, pregnancy rates are lower than those in IVF. Nevertheless, success rates using artificial insemination may reach approximately 20% per cycle if the couple perform the treatment each month. For precaution and risk, to compare, artificial insemination can be considered as a highly safe and minimally invasive reproduction treatment that patients will encounter, such as mild cramping. Complications like infection are very rare to occur that are lower than 1%. However, the chance of having multiple pregnancy is increased that results in twins, triplets or more when having this artificial insemination procedure. Okay, this one is about the point of view based on several religions and beliefs. Each of the religions have quite different perspectives based on this assisted reproduction method issue. But we will focus more based on the Islamic standpoint. Okay, Islam allows this reproductive treatment to be performed as long as the eggs and sperms been taken out from a legitimate husband and wife, in which their marriage is still valid and in contract in a continuing marital life, which ends either by death or divorce. For instance, a couple undergo IVF treatment and decide to freeze their sperms and eggs to be used in the future ahead. Unfortunately, one day her husband passed away, but then the wife chose to undergo IVF treatment using her late husband's freeze sperm. Okay, this procedure is absolutely prohibited in Islam because its approach was not undertaken in a continuity marital life, as the husband already passed away. Also, Islam prohibits involvement of a third party or surrogate mother, which will be discussed more in the surrogacy later. Okay, for this slide is about the comparison between IVF and artificial insemination, in which we can see that IVF occur in the glass dish, meanwhile artificial insemination involves a taken out sperm injected directly into uterus. Other than that, we can see that IVF provides better choices rather than artificial insemination, but still it is up to the couple to choose whatever method that they prefer for themselves. Okay, so now let's us proceed with surrogacy.
Assalamualaikum warahmatullahi wabarakatuh. My name is Rizati bin Azarif, and today I will explain about surrogacy. What is actual surrogacy? Surrogacy is a method of assisted reproduction where intended parents work with surrogate mother that will carry and care for the baby until birth. In short, this process involves a third party as the surrogate mother. There are two types of surrogacy. The first one is traditional and the second one is gestational. Traditional surrogacy is artificial inseminated surrogacy, which the donor is anonymous or intended. From the figure above, you can see that traditional surrogacy is using the IUI process. The second one, gestational surrogacy, is involving the removing of an egg from the intended mother to fertilize with the sperm of intended mother. Then the embryo is transferred to the surrogate mother. As you can see also from the figure above, the gestational surrogacy is from the IVF process. There are three conditions of surrogacy. The first one is the embryo. The embryo is created in the lab at fertility clinic. The embryo is fertilized by using the ovum and sperm from the intended parents, which is the second condition that is external. The last one is the surrogate mother. Surrogate mother is the mother who carries the baby until birth or to the term. This is the simple process or an overview of the surrogacy process. The first one is to apply as the surrogate of parents. Second one, the matching of surrogate and the parents. The third one, if the surrogate mother and the parents are matched. So there is medical screening and embryo transfer to the surrogate mother. And there is confirmation of the pregnancy as being made until throughout the pregnancy until the delivery. This is the form of surrogacy. The first one is sperm and ovum of the couple fertilized lab or transferred as a woman. The second is sperm and ovum of the couple fertilized lab or transferred another wife form. Meaning here, even though the other wife or husband is married another wife, the wife is still prohibited to be the surrogate mother and do the surrogacy. The third one is sperm and ovum from different men and women and transferred to another woman. meaning here that sperm and ovum are from different person, and the another woman, the surrogate mother, is also another person, which is the third form involving the money. Involving the money, where after delivering, the parents pay the surrogate mother for the surrogacy. Then there is the fourth form, the husband's sperm with a surrogate woman ovum. The woman will carry the baby. It is also involving the money, where the surrogate woman that garner the ovum will also be surrogate mother and carry the baby. And lastly, the wife ovum is another man's sperm transferred to another woman, meaning that the surrogate mother is another person and is involving the money. So what is the Islamic point of view of this issue? The surrogacy issue has been debated since mid-80s. This issue is considered impermissible and prohibited in Islam, as it includes a third party. This is aligned and in accordance to the international fatwa bodies in Islamic Research Institute. This happened because when it involves a third party, it relates to a question and confusion of who is the rightful mother of the baby. Is it the woman who donated the ovum, or the woman who borrowed the womb to carry the baby? So local fatwa institutions also issued their fatwa regarding this issue. So from Pahang, there is second Pahang State Legal Consultative Committee that state that using surrogate mother is prohibited even if the sperm and ovum are taken from legitimate husband and wife, or confusion will happen towards the child lineage. Sperm, ovum, embryo, and womb donation by a third party or the usage of other methods are prohibited by Islamic law. The second one is from Selangor. The Fatwa Committee for the State of Selangor issued a law that states the use of surrogate mother is prohibited. Using the method of surrogate mother conceived is prohibited by Islam even though the sperm and ovum are taken from legitimate sources, as it will cause the confusion of the nasab and nature of the child to be born. As you can see here, both fatwa state that even though the husband married to two wives and is legitimate husband and wife, the second wife or the first wife still can be a surrogate mother and the surrogacy is still prohibited. So in conclusion, a child is a gift from Allah to his servant, but if his servant are unable to conceive the child, it may be a form of test from Allah. It is a true Islam. It's an easy and flexible regime. However, we should not contradict with the guidelines and practices of Sharia. Meaning here we can use IVF, or we can adopt it, or we can use any other assisted reproduction method as long as it's not involving third party and not prohibited or impermissible by Islam. That's all from me. Thank you.